Hi, this is Terri Coutee with DIEP C Foundation, and I am visiting San Antonio this week, and I can stop by to see Dr. Minas Chrysopoulo from PRMA. How you doing?
I'm doing very well, thanks.
Good.
How are you?
I'm good. It's really good to be back and knock out some more videos with you. So I have a question about some wounds, because it gets brought up a lot, and we have questions about it. One of the things I wanted to ask you about wounds, when patients come in with certain medical comorbidities, for example, I don't know if I'm pronouncing this correctly, but a woman said that she had a factor V, is it Leiden?
Factor V Leiden.
Oh, okay, factor V Leiden.
Yeah.
If they, oh yeah, go ahead.
Yeah, that's more of a clotting problem.
Exactly.
Rather than a wound healing problem. So factor V Leiden increases your risk of blood clots forming. So for microsurgical procedures, so the tissue transplantations we do where we disconnect tissue from one part of the body, transplant it to the chest and reconstruct it by connecting blood vessels. When a patient has a problem like factor V Leiden, it increases the risk of a clot where we connect the vessels at the anastomosis. That doesn't really impact wound healing.
Okay. But this is good information because
Yeah.
it's certainly something they need to report on their.
Oh yeah, for
Need to
sure.
talk to
It's very underreported, factor V Leiden, and
Okay.
increases your risk of flap failure, so things not working out. And there are definitely things that we do when we know a patient has factor V Leiden to decrease the risk of complications. So for some surgeons, factor V Leiden is a contraindication to microsurgery, but I think that most microsurgeons are okay doing it as long as they know ahead of time and we can plan for it using blood thinners with Lovenox, that kind of stuff.
Okay.
For wound healing issues, it's really other health conditions like diabetes in particular.
Right.
Patients who don't have a favorable body mass index, so that increases your wound healing problems. Smokers, of course, so the worst trifecta is a smoker who's overweight and who's diabetic.
Right.
Even healthy folks who don't have comorbidities can have wound healing problems. Sometimes it's because we haven't recognized that that they're not eating well enough. Their nutrition isn't what it needs to be. So nutrition has to be really tuned up before and after major surgery.
Okay.
And we check protein levels and other things to make sure that that's all tuned up.
Is there a percentage of women that have, the question was asked, but to me it's kind of dependent, I think, on the success rate of the surgeon in my mind, but maybe not. Is there a percentage of women that have wound issues?
It varies a lot.
Women or men that have breast reconstruction?
So there's always a risk,
Yeah.
even in someone who's completely healthy, with a phenomenal surgeon. So the risk is never zero. I would say the risk ranges between 5% and 40%.
Yeah.
There are some papers out there that people who have a lot of comorbidities, you can have a risk of wound healing issues over 50%. Right, and it's also very important to define what a wound means, right? So if you include some superficial scabbing that just leaves you with a slightly ugly scar,
Right.
then obviously the risk of those, if you include those, the number's very, very high. If you say no, I'm not talking about that superficial stuff, just the stuff that I'm going to need a major intervention, like a wound vac or prolonged dressing changes or going back to surgery. Patients who have major wound healing issues like that are very few, thankfully.
Yeah.
Especially if you're tuning up the patient ahead of time to make them as fit and healthy as possible for surgery.
And I'm smiling a little bit because I have to say, I think when you're a patient and you get any kind of wound, there's a risk analysis for patients. Sometimes gets skewed with our concerns. Do you know what I mean? A wound after any surgery, a small wound might be a large wound to a patient. Do you know what I'm saying?
Perception is everything.
Yes, thank you. That's exactly what. So last question, and then we'll wrap this one up. How far out normally, the question was asked, how far out do wounds happen? Is there like a time frame? Because someone might be rolling along, everything looks great, boom.
Yeah, most wounds happen during the initial healing period.
Which is
the first couple of weeks.
Okay.
Further, beyond that, it becomes less likely.
Okay.
If things aren't going to heal because of the risk factors we mentioned, then by a couple of weeks, you see the signs of it. Beyond that, you can develop really small wounds if the patient isn't tolerating a suture, or if there's a superficial suture or a suture that isn't being absorbed. You can get what's called a superficial suture abscess or something like that. With a tissue-based reconstruction, once you're beyond the initial healing process, you're done. Ladies who tend to have a higher risk of problems later, even after they've apparently healed and it's been a long time, are implant patients. So the typical scenario is a lady who's been reconstructed with an implant-based reconstruction, or tissue expander, or who has the final implant put in, especially if they've had previous radiation. So those ladies sometimes will develop a late kind of wound. But for most people, it's early on.
Okay. Very good. Thank you very much.
Cheers.
All right.